The theme of this year's World Health Summit is taking global health to a new level. It sounds great, but what does it mean? Let me suggest three things. First, taking global health to a new level means we need a new global agreement or global accord based on a shared vision. At exactly the moment when the world needed to come together to face this common threat as one, the COVID-19 pandemic has been characterized by a lack of cooperation and coordination. When we can only face shared threats with a shared response, based on a shared commitment to solidarity and equity. That's what the pandemic accord or pandemic agreement that countries are now negotiating is all about. An agreement between the nations of the world to work together, not in competition with each other, to prepare for and respond to epidemics and pandemics. In 1968, at the height of the Cold War, countries across ideological divide came together to sign the Nuclear Non-Proliferation Treaty. Today, it remains as relevant as ever. In the same way, the global accord now being negotiated will underpin the global approach to epidemics and pandemics for decades and maybe even centuries to come. And that's why we call it generational agreement. I need to be very clear. This accord or agreement is being negotiated by countries, for countries, and will be adopted by and implemented by countries in accordance with their own national laws. The claim by some that this accord is an infringement of national sovereignty is quite simply wrong. It will not give WHO any powers to do anything without the express permission of sovereign nation states. If nations can negotiate treaties against threats of our own making, like nuclear, chemical and biological weapons, tobacco and climate change, then surely it makes sense for countries to agree on a common approach to a common threat that we did not fully create and cannot fully control, a threat that comes from our relationship with nature itself. Such an agreement will provide an essential framework and foundation for other initiatives to keep the world safe, which leads me to my second suggestion. Taking global health to a new level requires a new global architecture that's coherent and inclusive. Just as the pandemic exposed political vulnerabilities, it also exposed technical and operational vulnerabilities in the world's collective ability to prevent, detect, and respond to outbreaks and epidemics. It's clear we need new and better tools to build a new and better architecture. Several parts of that architecture are already being constructed.